Hello, I'm Charles Herbaux from Hematology Unit in Lille, France, and I'm happy to present you here an overview of our poster that was just presented at ASCO about the combination of atezolizumab, obinutuzumab, and venetoclax in the treatment of relapsed refractory diffuse large B-cell lymphoma. This is a LISA-sponsored multicenter phase 2 trial evaluating, like I said, the combination of these three drugs in relapsed and refractory non-Hodgkin's B-cell lymphomas. And here I'm presenting the primary efficacy and safety data from the diffuse large B-cell lymphoma cohort. The rationale of this study is to try to establish a virtuous circle with some drugs that are going to kill the tumor cells, like venetoclax and obinutuzumab. They're going to hopefully kill the tumor cells directly and release some tumor antigen. And then we try to enhance tumor anti-tumor immunity with atezolizumab, which is going to kill indirectly cells and enhance cell death, etc. Inclusion and exclusion criteria were pretty standard. You can find that on the abstract. And the three drugs were given approximately every 3 weeks for first period an induction of 6 months, where the obinutuzumab was given at day 1, the atezolizumab on day 2, and venetoclax continuously at 800 milligrams per day orally. After this induction phase, maintenance phase was begun with only atezolizumab and venetoclax. The primary endpoint was the overall metabolic response rates by Lugano criteria at end of induction, so after 8 cycles of the 3 drugs, or at premature treatment discontinuation. We included 58 patients, and their baseline characteristics were those of a pretty heavily pretreated population, with more than 2 prior lines of therapy in 83% of the patients, and 63% of the patients were refractory to prior regimen. The overall metabolic response rate at end of induction was 23.6%, and we did observe a significantly higher overall metabolic response rate in patients with a bulk with the highest diameter mass below 5 centimeters, around 38.5%. The median follow-up was 9 months, and we didn't observe any differences according to cell of origin. In terms of safety, 84% of patients experienced grade 3 or 4 adverse events, and the grade 3 or more reported AE in at least 10% of patients were pretty standard: neutropenia, lymphopenia, thrombocytopenia, and anemia. And of note, we did observe 2 immune-related adverse events with an autoimmune colitis, grade 3, and 1 grade 1 hypothyroidism. So the take-home messages is that the combination of atezolizumab, obinutuzumab, and venetoclax appears well tolerated with no unexpected safety signal, and that the overall metabolic response rate at end of induction of overall 23.6% was promising, and probably even more promising in the setting of the patients with a low tumor burden. Thank you for your attention. I would like, of course, to thank the patients and their family and all my co-authors in that study, and especially Professor Guillaume Cartron, which is the senior co-PI of this study.